Hi, I'm Dr. Maneesh Gupta. I'm a senior consultant psychiatrist based in Dwarka, Delhi. I'm going to talk now about your children. Yes, your children. They are the apple of your eye. They give you a lot of pleasure. But sometimes they don't listen to you. They don't study well. They irritate you. They beat other kids and you get complaints. And that is when you feel, oh God, who should I go to? Who can help me? A psychiatrist can. Whether you are parents or grandparents, if your child is behaving in a manner where you feel you cannot control him, or if a child is not able to study as effectively as he or she should, then please consult me before it gets into a habit, before it gets worse, before your child no longer is a child, becomes an adolescent or an adult, where the consequences of these behaviors or the lack of academic expertise is much more. How do I help? Well, first of all, I need to talk to the child. I need to talk to the child's primary carers, whether it is grandparents, parents, mother, or even an ayah. And do remember to bring your child's school copies along. But remember, if your child is less than 10 years old, I would speak to him perhaps for less time than I would speak to you, the primary carer. That is because a 10-year-old child does not have the mental capacity to be counseled. You cannot tell a child what to do and what not to do and expect him to understand that. You need to create an environment where gradually he imbibes the environmental culture and does what you expect him and what you want him to do. That is where behavior therapy works. That is why in children less than 10 years old, behavior therapy is a very important component, and it would involve parents, grandparents, siblings, and full-time maid if you have any. Medication is also available, but I use that for the very unwell, for a child who is so hyperactive that his brain doesn't settle down at all, for a child who cannot pay attention to a task for very long. Such a child would be doing very badly in academics, would not be keeping to boundaries, would be interrupting you, jumping around the house, would not even be watching TV consistently, and his speech would have delays or other improprieties. His teachers would say that he misses alphabets or he writes them opposite to how they are. Teachers might say he doesn't sit still in class, he disturbs other kids, or that he interrupts while she is talking or she is teaching. That is a child who does need help, and medication can help restore the balance of chemicals in his brain. We call it a dopamine imbalance, and we have medication that can rectify that imbalance such that your child gradually begins to look at his environment the way he should be looking at it, an environment which is facilitating, supporting, and caring, not an environment which is against him, but an environment which is his friend. And that is when your child would begin to develop skills, knowledge, and behaviors the way a responsible adult should do. We might give this disturbance a name. Sometimes we call it conduct disorder, and sometimes hyperkinetic disorder. But please remember, by whatever name we call it, it is a problem during the foundation stones of a child's life. If you do not get a psychiatrist to look at him now, it is going to be a much harder battle and a much more difficult battle later on in life. So do try and look at your child and see if he or she needs a smile, and bring him to me, and I'll bring back the smile both on your face and your child's face. Thank you.